Hello, my name is Professor Gregor Jemmet from the Department of Dermatology, University Hospital Zealand in Roskilde. I'm the senior author of the paper Prevalence of Patients with Self-Reported Hidradenitis Suppurativa in a Cohort of Danish Blood Donors, a cross-sectional study.
And my name is Theut Riis, also from the Department of Dermatology, University Hospital Zealand in Roskilde, and I'm the first author of this paper.
So, why did we do this study? Hidradenitis suppurativa is not a well-studied disease, and most studies focus on patients which are recruited from secondary or tertiary level care. While interesting, this only represents a minority of patients. The majority of patients have mild disease and have not yet been referred to dermatologists. Hence, we saw the need to study the disease in a population cohort.
So when we got the unique opportunity to take part in the Danish blood donor study, we leaped at the chance. The Danish blood donor study presents questionnaires to blood donors nationwide, and donors also agree to let us have a look at information collected by Statistics Denmark in a way that allows us to link information from the questionnaire to information on income, education, etc. in a pseudo-anonymous way.
So how did we do it? We used a validated screening questionnaire to determine the prevalence of HS in the cohort of blood donors, which also let us divide the cohort in donors with HS and donors without HS. The questionnaire also contained informational items such as sex, height, weight, smoking habits and alcohol consumption.
Using secure service, we linked the data to information on education, job status and incomes from Statistics Denmark. We also checked how many of the cases with hidradenitis suppurativa were already registered in the National Patients Database.
And what were our main findings? Well, we found 500 donors with HS in a cohort of 27,765 donors, corresponding to a prevalence rate of 1.8%. This is in good line with the current perception of a prevalence of HS between 1 and 2%, and this is in spite of the obvious selection bias towards healthy donors.
Donors with HS smoke more than those without, but much less than patients with HS recruited from hospitals and in other studies. Donors with HS also have a higher body mass index than those without, but again not as much as patients with HS recruited from hospitals. To us, this suggests that donors with HS had a milder phenotype of HS than hospital-recruited patients.
We also found that HS donors had considerably lower income than donors without HS, but they were also younger. So we used a regression model to determine the effects of HS on income corrected for age, BMI and sex. We found that being screened positive for HS did not affect income, but the difference were largely due to donors with HS being younger.
We also found that only 2.2% of the patients screened positive for HS were registered with hidradenitis suppurativa in the National Patients Database, compared to 0.15% of donors screened negative. This could suggest coding issues, a poor screening tool, or simply that many of the donors had a mild undiagnosed disease, which is in line with a previous report that showed 7 years diagnostic delay of HS.
So this raises the important question of why this study is relevant to dermatologists and their patients. Is it important because epidemiologic information should be acquired from a suitable source population and while a random selection of adults from Denmark would be better used, we were able to use the infrastructure available from the Danish blood donor study to achieve a large sample from a population similar to the general population. Prevalence is an important guide to decision-making, and it seems that many mildly affected patients remain undiagnosed and significant improvement is needed in this area.